Okay, now we're gonna demonstrate the Dutch tourniquet. Remember, a tourniquet is only a last resort if I've already tried to apply direct pressure and an increased pressure and that still was inadequate, or if there was an amputation, or if there were multiple patients or multiple severe bleeds, in which case I was forced to go straight for a tourniquet. Now, when I apply a tourniquet, I'm always going to place it about 5 centimeters, 4 finger lengths, proximal to the injury. So assuming the bleeding is here, I'll place 4 fingers, that's 5 centimeters, and go proximal to the wound. If I'm on a joint, then I'll go above the joint. Never place a tourniquet on the joint. The Dutch tourniquet is very simple because it can be made out of pretty much any long piece of material. I'm going to use a triangular bandage. It comes in a package like this. You take it out, open out the triangular bandage into a long piece of material. You can use a necktie, a kerchief, tear open a shirt, anything that you can make into a long piece of material. And so it's a great tourniquet. You can make it out of almost anything. Okay, so now here we fold it in half, literally just fold it in half. And I'm gonna go over here, right? Let's assuming the wound was here, went 5 centimeters proximal, we're on the joint, so I'm going above the joint. I got the loop over here and I got the 2 ends here. I'm gonna stick the 2 ends through the loop and simply just pull both ends. I'm gonna grab both ends in the opposite direction. By pulling down both ends in the opposite direction, I will be tightening it. Try to get as close to the ends as you can so you can get it really as tight as possible, and just pull till you see the bleeding stop. Once you see the bleeding stop, then come around and tie the tourniquet. Remember, what's holding it is the pressure of you having pulled it tightly, and here you're going to tie it to hold it in place. I'm just going to tie a knot, and in order to keep it in place, whenever you tie in a tourniquet, make several knots, make numerous knots, make sure that it can be opened easily. Remember, the tourniquet is very painful, and if the patient is conscious or semi-conscious, they may instinctively try to pull it off because of the pain, so make sure you tie it very tight. How you doing? Alrighty. Obviously, you want to make sure that you're going to do it as tight as possible, and you want to make sure the bleeding stopped. If you see that the bleeding hasn't stopped, so you can always place another one proximal to the one that you placed already. Alrighty. See you next time.